Hi everyone, welcome back to XGate Dental. I'm Emmanuel Kadosh, and we are here to discuss new procedures in the field of dentistry. We will provide interesting new cases to exhibit how doctors use our products to solve complicated dental cases, so don't forget to subscribe and follow in order to stay up to date. Today we want to show you a case where we did an immediate loading on implants on the lower jaw, cross-arch bridge 6 crowns. In this photo, you can see that using the intraoral scanner is going to be a hard job because you can see all the soft tissue around the healing caps, and you can see that the soft tissue is movable and it's not rigid. So when you're scanning, if you want to insert the scan abutments in the place of the implant, you'll have a pretty hard time. You won't enjoy the process because every time you want to move from one scan abutment to the other, the gingiva will move a little bit as well. And the end product that you'll get won't be as precise as it's supposed to be. Because in the lower jaw, you have the tongue that you can see this patient has a very large tongue. He didn't have his lower teeth for quite some time, which means that the tongue will become larger. So the tongue is very large. You can see that when we place the implants, there is no place for the tongue. You always have the tongue in the scanning process, and you have a lot of movable gingiva around the implant. So if you just put a scan abutment and you'll scan around the scan abutments, you'll always get different kinds of texture. The intraoral scanner can fix it on the scan abutments, but between two scan abutments, you have some gingiva, and this gingiva will always move a little bit. And in this case, it will be very, very hard, almost impossible to scan those implants without any different type of methods or help. On the lower jaw, we had implants. On the implants, we placed metal caps, and about 3 days after the implementation, we placed the bridge. And the scanning process was done immediately after placing the implants. So you will have saliva, blood, and movable gingiva, tongue, and everything in one big fun package. This is all immediately after the implantation. You can see you don't even have blood clots and everything's super fresh. You have 6 implants all in all. This is after 3 days. You can see you have a little bit of fibrin, blood clots. There's not too much blood. Right now, it's a little bit easier to scan. As you saw previously, the multi-units that we placed right after the surgery, we placed the multi-unit and the scan abutments on the multi-unit. Then we took off the healing caps and we changed them to scan abutments. Now you can see 6 scan abutments. You can see that because it was done 3 days after the surgery, you don't have this large amount of blood. So it will be a lot easier. It's all multi-unit scan abutments and all the implants are parallel, and it's not a very difficult case if you're looking at the process and the angulation of the implants. But the most difficult part here is taking the impressions themselves. If you want to take an impression with an open tray with transfers, it's very difficult because he has a very large tongue. He needs to open his mouth very wide. There's also a little bit of bone absorption. He didn't have his lower teeth for quite some time, so there was no extraction at the time of placing the implants, so you don't see the sockets of the teeth. He didn't have any teeth at all. Now, what we chose to do is connect all the scan abutments with a composite material. The yellow material that you see, it's like a composite. We connected all the scan abutments, and this way, when we scan, we have one rigid-like bar that connects all of the implants. The scan abutments themselves, when we modeled the teeth, you can use this part of the scan abutment, but when you're scanning the whole part, the whole bar, the whole assembly of the scan abutment composite material. So this way, the scanner always has a rigid part to connect the next shot to. So it basically holds the jaw together for you to scan. It connects all the scan abutments together. Now, when you're using this type of composite material, the next thing you want to do is to take relations. You want to know the height of the restoration that you want, and you can know these restorations or fix those relations using this composite material as well. Because the first scan that we want to have is the scan of the scan abutments like this, and this way we can scan the scan abutments from all around, and you can have the scan abutments and the composite material and a little bit of the gingiva. So your technician knows where the gingiva is and where the scan abutments are, and you don't have all of the composite material interfering with the scan abutments. Now, the second part that you want to do is you want to have the relation between the lower and the upper jaw, the mandible and the maximal. So in the second stage, you'll add the composite material and you'll cure the composite material in the right position of the lower jaw. So this way, you'll get the relations and you can scan a second time and you can connect the 2 scans. The first scan with a small part of the composite material, with the scan abutments, and the second scan with a lot of composite material and without the gingiva and everything else, but in the right relations. Here, you can see the process when we apply composite material between the scan abutments and we cure it right away because we want to just save time. You have some time before the material hardens in the syringe itself. So the assistant is curing and the doctor is applying the composite material, and any doctor can really do this. You can do it also not with the composite material, but with a different kind of acrylic or something similar, but with composite material, it's very comfortable. You can do it very fast and save chair time. This video is real time. We didn't make anything faster or anything like that. Now it's moving a little bit slower, but what we want to show is that the whole process takes about 1 minute, and this is while we're filming it. So it takes a lot of time because you have a camera and you have a doctor that doesn't see what is happening inside of the mouth. And then you also have an assistant that doesn't see also what is happening in the mouth. When it's only the doctor and the assistant, it's much easier and much simpler. It takes even less time. When you're using this technique in many cases, it's because it's a very difficult case. From the start, you know that you'll have problems. So here we know that we'll have problems and we just don't even bother trying to do anything else. Now, let's take a look at the second scan when you already have the occlusion. I want to show you now how the doctor is scanning inside the mouth, but we see on the screen. Here you'll see the speed of the scanning and you see the scan abutments on the screen. This is what the doctor sees. You can see some part of the gingiva and you can see the scan abutments, and what you scan is the composite material with the scan abutments. Then using the scan abutments, you can find the right position of the implants. Even now, it's a little bit harder because first of all, you have a beard and it takes a lot of time and you need to connect all of the dots and you need to scan from all of the angles. But without the light curing composite, it would be much harder because you can't skip from one scan abutment to another. Here we can see that the composite material and the relation of the mouth. When he closes his mouth, you can see that he always closes in the same relation. So this is how you can be sure that you have some relations. Maybe these relations are incorrect. Maybe for the final bridge, it will not be the relation that you want. But from this relation, you can make a provisional bridge and you know approximately the relation that it will be. Maybe the crown height will be too hard to mill or you'll want to change the relation, but you need something to start with. Some kind of primary relation for the first provisional bridge. This is why we're making it this way, and now we can scan the scan abutments and we scan the relations of both jaws. So we have the first scan with a small amount of composite and you have the final scan. Now we can assemble all the scans and we have the scan abutments and we can have some kind of bridge in those relations. So now you would make a temporary bridge, wait 3 months, take it off, make corrections, and make the permanent bridge. Now you have immediate loading. After immediate loading, you have a maximum of 3 to 4 days to make some kind of bridge and assemble and screw the bridge into the implants. And then you need to wait 3 to 4 months before the next step, before the osseointegration is completed or in some way complete. It's a case that we'll still be working on. These pictures and videos are from last month, so we don't have the provisional bridge, and it's something that we do a lot of times, but we have already shown you in some cases with this type of technique where you take relations and you connect all the scan abutments with composite material. But this time we also took a video to show you how easy it could be done. Thank you all for joining to learn some new and interesting information. Make sure to stay tuned for more. And of course, don't forget to subscribe, like, and follow. Thank you and see you next time.